We now come to questions. Secretary of State for Health and Social Care, Lord Hatton.
So on my best wishes. In South Dorset, we urgently need to restore... Oh, sorry, question number one. I got carried away with celebration.
His birthday's blown.
Thank you, Mr. Speaker. Can I, on behalf of His Majesty's Government, congratulate the honourable member for Strangford on reaching, I think you said 70th, I'm sure you meant 60th, Mr. Speaker. Mr. Speaker, in response to my honourable friend, we promised in opposition to transform the NHS into a neighbourhood health service, and we've hit the ground running. As a first step, we've announced the biggest boost to GP funding in years, an extra £889 million, recruiting 1,000 more GPs. On dentistry, we're delivering 700,000 extra urgent appointments, and we've given adult and children's hospices a once-in-a-generation £100 million funding boost. And at the same time, we're delivering our plan for change, cutting waiting lists 5 months in a row. Change has begun, but the best is still to come.
Thank you, Mr. Speaker. In South Dorset, we urgently need to restore clinics and shift services back into our community hospitals in Weymouth, Portland, Swanage and Wareham. Sadly, the previous Conservative government hollowed out these community hospitals, meaning services left our towns only to go further and further up the road. And this is coupled with poor transport links, meaning that many local people in my patch find it difficult to access the care they need. So with this in mind, what steps is the Minister taking to restore clinics and services in our community hospitals? And will the Minister support my campaign to restore the chemotherapy clinic at Wareham Community Hospital?
Secretary of State.
I'm grateful to my honourable friend for his question. The big thrust of our 10-year plan will be to deliver on the 3 shifts from hospital to community, analogue to digital, sickness to prevention. We believe that by moving services closer to people's homes and indeed in their homes, we'll be able to provide faster diagnosis, faster access to treatment, better for patients and better for taxpayers. We are also, through the reforms we're making to the structure of NHS England and the governance of the NHS, presiding over the biggest devolution in the history of the NHS, with more powers and decisions taken closer to the communities they serve. In that spirit, I'd urge him to make representations locally to his ICB, as I know he's doing. Ministers will be open to receiving his representations.
Sir Oliver Dowden.
Yeah. Thank you, Mr. Speaker. Following the government's regrettable decision not to fund Watford General Hospital's refurbishment in this Parliament, providing community care facilities in a town like Boreham Wood in my constituency, a significant town without its own dedicated facilities, is more important than ever. Can the Secretary of State for Health undertake to urge the ICB and others using his offices to get their act together so we can finally have that in Boreham Wood?
Mr. Speaker, I'm very sympathetic to the argument the right honourable gentleman makes about the importance of neighbourhood health services in Boreham Wood and indeed in towns and communities right across the country. What I am not sympathetic to is a former Deputy Prime Minister now complaining about the state of the NHS that he was a key part in creating when he sat around the cabinet table.
Rachael Maskell.
Thank you, Mr. Speaker. 1 in 3 hospital admissions occur in people's last year of life, and 43% of people will die in an NHS hospital. Clearly, that is not acceptable when people are at their frailest. Could my right honourable friend say what he's doing to invest in virtual wards so we can keep these people at home, and also in the district nurse workforce to ensure that they've got a proper career structure and it can be a profession of choice once again?
My honourable friend is absolutely right about the innovation and the impact of virtual wards. I've seen firsthand the impact that can make, not just providing better value for taxpayers and freeing up hospital beds for those who genuinely need to be in hospital, but actually providing what everyone wants, which is wherever possible to receive high quality care in the comfort of their own home. That will be a big part of our 10-year plan and of course underpinned by really good community nursing and community healthcare teams too.
Lisa Smart.
Very much, Mr. Speaker. Stepping Hill Hospital in Hazel Grove has a huge repairs backlog, and we've got patients who are having to park miles away in order to get to the hospital. We've had corridors flooded, and we've had frequent power cuts. I, alongside Stockport Council, the local hospital trust and the community, are calling for an additional site in Stockport Town Centre, whether a diagnostic centre or otherwise. What assurance and support can the Health Secretary give my constituents that they will be able to get the health services they need closer to them?
So stay.
I'm grateful, Mr. Speaker, for that question. I'm very well aware of the challenges at Stepping Hill Hospital and the need for investment and support in services in Stockport, not least thanks to the representations of my honourable friend, the member for Stockport. We are looking very carefully at this situation and committed to working with leaders locally to try and improve the quality and access to services that people locally deserve.
Andrew Cooper.
Thank you, Mr. Speaker. A new state-of-the-art surgical centre is set to open at the Victoria Infirmary, Northwich, in the next few weeks. New facility will be a centre of excellence and a regional hub for outstanding cataract care, and is an excellent example of how we can reduce pressure on our major hospitals while making the best use of facilities in the heart of our communities. Will the Secretary of State join me in congratulating Mid-Cheshire hospitals on completing this project, and can I invite him to join me in a visit to the centre in the coming months?
So stay.
I'm grateful to my honourable friend. I absolutely join him in congratulating the local trust for the work that they're doing and the impact they're having, and I'd be delighted to pay a visit as soon as my diary allows.
Julia Lopez.
Thank you, Mr. Speaker. The new St George's NHS hub in Hornchurch has freed up space in Queen's Hospital in Romford to remodel the A&E there. Will the Secretary of State now fund that remodelling so that our constituents can get better emergency care?
I'm very grateful to the honourable member for raising the need for investment in the accident emergency at Queen's Hospital in Romford. As she alluded to, this accident emergency department serves my constituents too. So this will be a rare occasion where at the dispatch box I urge her and encourage her to lobby my honourable friend, the Minister of State for Health, because in such decisions I must recuse myself, but she'll know where my sympathies lie.
Rosie Wrighting.
Question number 2, Speaker.
Minister.
Thank you, Mr. Speaker. With your permission, I'd like to take questions 2, 9, 10, 12 and 18 together. Rebuilding our broken dentistry system is a priority for this government. We are already rolling out 700,000 extra urgent dental appointments per year, as promised in our manifesto. We have launched a supervised toothbrushing scheme for 3 to 5-year-olds, and we are committed to reforming the dental contract and making NHS dentistry fit for the future in the long term.
Rosie Wright.
Thank you, Mr. Speaker. In Kettering, we know the scale of the challenge facing NHS dentistry after 14 years of Tory failure. My constituents regularly tell me how impossible it is to get an appointment. Some are driving tens of miles to see a dentist, and it's simply a scandal how many children are admitted to hospital with tooth decay. While it cannot be rebuilt overnight in Kettering, we welcome the extra 17,000 urgent appointments, and it's a vital first step. But can the Minister confirm that it is this government that will make NHS dentistry fit for the future?
Well, I thank my honourable friend, and she's absolutely right. After 14 years of Tory neglect and incompetence, far too many people are still struggling to find an NHS appointment. This government is tackling the challenges for patients trying to access NHS dental care by delivering 700,000 more urgent dental appointments per year and by recruiting new dentists to areas that need them. My honourable friend's local ICB has been asked to deliver nearly 17,000 of these additional urgent appointments. I am in no doubt she will continue to campaign tirelessly on this issue on behalf of her constituents.
Anneliese Midgley.
Thank you, Mr. Speaker. My constituent, Kevin Buckley's NHS dentist shut with no notice. NHS dentists in Knowsley are not taking any new patients, and he is stuck. This isn't just a local issue, it's a national crisis. So what action will the Minister take to address the shortage of NHS dentists?
Well, I thank her for her question. I'm very sorry to hear of the difficulties faced by Mr. Buckley. Sadly, that's a challenge which is faced nationally after 14 years of abject failure from the benches opposite. There are no quick fixes or easy answers, but we're committed to reforming the contract and helping those who need it most. My honourable friend's local ICB has been asked to deliver over 46,000 additional urgent care appointments from April onwards, getting care to those constituents who need it most. The North West has also allocated 21 posts in the Golden Hello scheme to recruit dentists into underserved areas.
David Williams.
Thank you, Mr. Speaker. More than 1 in 3 5-year-olds in Stoke-on-Trent have tooth decay. It's the worst rate in the West Midlands and 10% above the national average. Children in deprived areas, like much of my constituency of Stoke-on-Trent North and Kidsgrove, are twice as likely to suffer, and that is not acceptable. Can the Minister please outline what steps the Government will take to reduce regional inequalities in NHS dental access for children?
Minister.
I thank him, and it is absolutely shameful that tooth decay is the biggest reason for children aged 5 to 9 being admitted to hospital, and the inequalities around that are so stark. This is why, on the 7th of March, we confirmed investment of £11.4 million in supervised toothbrushing for 3 to 5-year-olds. This scheme is targeted at children in the most deprived areas, those in index of multiple deprivation groups 1 and 2, reaching up to 600,000 children. Our innovative partnership with Colgate-Palmolive will also see over 23 million toothbrushes and toothpaste donated, providing outstanding value for taxpayer money.
Alex Baker.
Thank you, Mr. Speaker. Aldershot and Farnborough are dental deserts. My constituent Nick had an infected wisdom tooth and was in agony. He'd been registered with a practice in Farnborough, but they kicked him off their patient list. He got an emergency appointment through 111, but 2 weeks later the infection was back. He was left with little choice but to go private, which cost him £700, 10 times what it would have cost on the NHS. Can the Secretary of State explain how Labour's plan for change will help stop cases like this being repeated, and as we end 14 years of dentistry failure under the Conservatives?
Minister.
Well, I thank her. Again, she's showing that she's a tireless campaigner for the people of Aldershot. I am sorry to hear of the challenges faced by her constituents. This government will deliver 700,000 more urgent dental appointments per year and recruit new dentists to areas that need them most. Her local ICB has been asked to deliver nearly 7,000 of those additional urgent care appointments in the year from April. In the long term, we are going to reform the dental contract with the sector with a shift to focusing on prevention and to improving retention of NHS dentists.
Thank you very much, Mr. Speaker. The Secretary of State and the Minister's commitment to 700,000 more emergency dental appointments is already taking effect in my NHS area with an extra 27,000 slots and is getting excellent feedback. However, some constituents have been in touch to say that some dentists in Great Grimsby and Cleethorpes seem to be removing non-emergency patients from their lists. Can the Minister please reassure my constituents that their NHS dentists will be there when they need them?
Yeah, I thank her for that question. She's right. We're delivering 700,000 additional urgent appointments. Patients aren't limited to a registered practice in England, and practices have a requirement to keep their status up to date on the NHS website. For anyone struggling to find a dentist, they should go to nhs.uk or call 111. It's also clear, whilst NHS England is not mandating an approach to the purchasing of these additional appointments, ICBs could consider the following options: buying more appointments through new or recommissioned contracts, or modification of existing contracts, and or using flexible commissioning.
Sir Roger.
Thank you, Mr. Speaker. The Minister is aware of my concern that there are some 200 Ukrainian dentists fully qualified but unable to practice because of the restrictions placed upon them by the General Dental Council. I know the Minister has written to the GDC about this. Has he had a reply?
Minister.
I thank the honourable gentleman, and I thank him for the very constructive meeting and discussion we had on this matter. He will know that we're exploring the use of provisional registration for overseas dentists. We are also urging the GDC to put more examinations on for dentists, and I have a meeting set up in short order with the head of the GDC, and I will keep him posted on that conversation.
Thank you, Mr. Speaker. In my constituency of Stratford-on-Avon, residents are being forced to travel out of county to Coventry or Evesham to access basic NHS dental care. Will the Minister agree that it is a disgrace that access to an NHS dentist has now become a postcode lottery, and what urgent steps are they taking to end this dental desert and restore NHS services to rural communities like mine?
Well, Well, I thank the Honourable Lady for that question. I agree absolutely. The state of NHS dentistry in our country is frankly shameful. We do have the Golden Hello scheme, which is for 240 dentists to receive a £20,000 joining bonus payment to work in dental deserts, and we are also in negotiations with the British Dental Association for the long-term reform of the contract. The issue is not around the number of dentists in our country, it's around the paucity of dentists who are doing NHS work.
Thank you, Mr. Speaker. The North West has some of the worst levels of children's oral health in England, with Cheshire and Merseyside falling below the national average. In my constituency of Chester South and Eddisbury, rural villages like Bunbury, where bus services have been cut, and Kelsall, where a dentist is keen to open an NHS practice but faces barriers due to city centre prioritisation, residents are struggling to access NHS dental care. Given the challenges of rural access, what steps is the Minister taking to ensure that NHS dental provision is available in these rural communities?
Minister. Thank you, Mr. Speaker. I do find it quite striking when members from the benches opposite stand up and describe the abysmal state of NHS dentistry, and you start to sort of think, well, who created this mess in the first place? But that's as an aside. The fact is that we have the Golden Hello scheme for dentists to come and work in so-called dental deserts. We recognise that the fundamental problem is around incentives for dentists to do NHS work. That is why we're doing a long-term contract negotiation to ensure that we have an NHS dentistry contract which is actually fit for purpose and where every penny that's allocated to NHS dentistry is spent on NHS dentistry.
James Wild.
Thank you very much, Mr. Speaker. There's an urgent need for dental training in Norfolk. So can the Minister confirm that the Government will enable the Office for Students to allocate new dental training places in the east of England to start in 2026?
I thank him for that question. I have met with honourable members from the area and have made it clear that we, in principle, support any creation of new teaching capacity for dentistry. What I have also set out is that before we can give an instruction to the Office for Students to go ahead with that work, we have to have the settlement of the comprehensive spending review so we know what our financial envelope is, and we won't have that until June, but certainly we will be looking at this as and when we know whether or not the funding could be available.
Jim Shannon.
Thank you, mate. There's only one Jim Shannon, by the way, you know.
Thank goodness.
Mr. Speaker, can I thank you very much for the birthday wishes? I'm terribly embarrassed, and to right honourable and honourable members for their kind wishes. As I often say, I don't count the years, I make the years count. That's the important part. Yeah. Can I ask the Minister a very important question, by the way? What discussions has he had with the Education Secretary on providing more financial support to young students wanting to study dentistry, to ease the burden of high costs associated with studying dentistry, which many young people may find off-putting? Mr. Speaker, thank you so much.
Minister.
Well, I thank him for that question. I congratulate him again on his 60th birthday. He raises an important point around teaching and training in dentistry. There is not enough capacity in the system, and we absolutely want to ensure that we are building that capacity. As I said to the honourable member earlier, a lot of this will depend on the comprehensive spending review settlement in June, but I'd certainly be more than happy to discuss that with him in greater detail once we've got a better sense of where we are in terms of the funding.
Hamilton.
Question number 3, Mr. Speaker.
Thank you, Mr. Speaker. The Government is committed to improving women's health outcomes, and we've already taken urgent action to tackle the gynaecology list through the elective reform plan and recently announced an £11 million trial using AI tools to detect breast cancer cases earlier. The 10-year health plan will set out how we tackle the factors that lead to poor health outcomes and the improvements we expect to see.
Thank you, Mr. Speaker. What assessment has the Minister made re the adequacy of research and the provision of fibroid treatment for women, taking into consideration that fibroids are 3 times more likely to appear to appear in black women than in white women? Thank you, Mr. Speaker.
Minister.
I thank her for that question. The government welcomes the work that she has undertaken and the work of the Caribbean and African Health Network and its role in highlighting health inequalities for black women. And these are shocking and unacceptable statistics that she has highlighted today. The NIHR has funded a significant amount of research into women's health issues, including a £1.5 million trial comparing treatment options for fibroids, and I'm happy to make sure she's updated on that work and the details of that work.
James Cleverly.
Thank you, Mr. Speaker. Early diagnosis and treatment of breast cancer can make a huge difference to the women involved and, of course, to the prognosis and the cost to the state of health provision. I welcome the reference in the cancer plan to early diagnosis, but what specifically will the government do to encourage greater awareness of the full range of breast cancer symptoms and encourage women to get early diagnosis, early treatment for better outcomes?
Minister.
I thank him for that question and the work that he has supported on behalf of, I know, his own wife around this issue, raising awareness. The screening access uptake is shockingly low across the country right now, and that has to form a key part of what we need to try and do to make sure that women come forward for that screening test. The AI work will support that faster response time so that we can get women treated more quickly, and absolutely forms part of what we need to do in the coming years.
Anneliese.
Thank you, Mr. Speaker. I'd like to put on record my thanks to the Health Secretary for coming to Nottingham last week and meeting with some of the families who have been harmed by extremely serious failings in maternity services at Nottingham University Hospitals Trust, and for his sincere commitment to them. It was clear just how moved he was by their stories. One of their asks is that the government implements the 22 recommendations from the Shrewsbury and Telford Ockenden reports. So I ask the Minister whether she's able today to commit to doing that.
Minister.
I thank her for that question, and I know that she and all members across the House, across the area, have supported the Trust, and particularly those families that have been affected. As she highlights, my right honourable friend visited last week and is deeply moved by those stories. He's committed to revisiting again, and the government is working through those recommendations and will update the House shortly.
Jess Bramford.
Thank you, Mr. Speaker. And following on from the honourable member's question, a few weeks ago I held a debate in Westminster Hall on maternity services and spoke to families across the country whose failures in the system ultimately left them without their babies to take home. It was a devastating experience for all involved. The Ockenden IEAs were supported by the previous government, and I know the Secretary of State for Health has been very vocal in his support for implementing the IEAs. But those families want to know how quickly will they see real change in maternity services up and down the country so that families can confidently go and deliver their babies.
Minister.
She is right to highlight the impact on women and their families across the country of the failures in maternity services, and she also highlights this is taken personally and looked at by my right honourable friend. We will work through and keep working closely with Donna Ockenden on those recommendations, and we will continue to update the House regularly. I know that that's a keen issue for members across this House representing their constituents, whether it be here, Mr. Speaker, or in Westminster Hall, and we are very keen to make sure we build that confidence, support staff, build that confidence for women across the family to have that time, a good time when they are going through maternity services.
Jodie Reid.
Question number 4, Mr. Speaker.
Secretary of State.
Thank you, Mr. Speaker. I'm grateful to Professor Sullivan for her reports. Sex and gender identity are not always the same, and it is important for patients that we record both accurately. I know the House will share my concern at some of the findings from Professor Sullivan's report, like trans patients not being invited for cancer screening because of how their gender is recorded. I can assure the House I'm already acting on the report. Last week I instructed the Health Service to immediately suspend applications for NHS number changes for under 18s to safeguard children. Taking such action does not prevent the NHS from recording, recognising and respecting trans people's gender identity.
Jodie Reid.
Thank you, Mr Speaker. Can I thank the Secretary of State for that reply, and it will give much-needed reassurance to patients across the UK. Any public body that fails to accurately record sex and instead conflates it with gender put people at serious risk of harm. Unfortunately, this type of organisational capture has been widespread across Scotland with devastating consequences. Can the Secretary of State assure me that he will raise this with his counterparts in the Scottish Government to ensure that NHS Scotland does not put my constituents at risk?
I'm grateful to my honourable friend for her question. I will absolutely give that undertaking to share with my counterparts across the United Kingdom the approach we're taking. The approach I've always taken is one that understands the importance of biological sex, that recognises, understands and supports that someone's gender identity may not always match biological sex, and to navigate a way through what has been an extremely toxic, sometimes harmful debate in a way that protects the sex-based rights of women and protects trans people and their identity. I know my colleagues across government are taking an equally sensitive approach. I think it would be in everyone's interest if we saw a similar approach across the whole of the United Kingdom, and not just in the provision of services, but in accurate data and research. It is important we make that distinction, which doesn't in any way undermine respecting the gender identity of people.
Thank you, Mr Speaker. The inquest into the tragic death of a young woman who lived in Eastleigh has highlighted the importance of continuity of specialist care for vulnerable people who move home. My constituent Alex is still waiting for an appointment for ongoing specialist care 3 years after moving to Eastleigh. So will the Minister meet with me to discuss the provision of mental health care in my constituency?
It's about sex gender. That's the problem with the question. Don't worry, I'm sure they'll pick up the Secretary of State's got the message. Right, can I come to the front bench? Dr Caroline Johnson.
Thank you, Mr Speaker. Given the Sullivan Review findings on patient safety and health safety as a result of inaccurate or poor data collection, can the Right Honourable Gentleman confirm what meetings he's had with the Secretary of State for Science, Innovation and Technology to discuss the reliability of data on sex intended to be used by the digital verification platform in the data bill?
I'm grateful to the Shadow Minister for her question. I speak to the Science Secretary on too frequent a basis, on a daily basis. He and I are both looking very carefully at the findings of the Sullivan Review and working through its implications for both the health and care services I'm responsible for and for the government digital and data services that he is responsible for.
Thank you, Mr Speaker. The UK Health Security Agency, for which the Secretary of State is responsible, publishes health statistics. This includes data on sexually transmitted infections that are published by sexual orientation and sex. But a footnote states that women are defined in the data set as women and trans women, which does undermine somewhat the value of the data. So what will the Secretary of State do to ensure that data is not just collected properly, but is published and presented in a way that is most clinically useful?
Secretary of State.
I think the honourable member raises a actually really good example of how conflation of sex and gender identity isn't helpful, both in terms of data analysis, but also recognising health inequalities and making sure that we are understanding variances between people based on their different backgrounds, different characteristics, and making sure we provide targeted, personalised and effective healthcare that deals with healthcare inequalities. That's why we are studying the recommendations made by Professor Sullivan carefully, with a view to making sure that we're meeting the needs of everyone, including the trans community, who I understand, not least because of the way the debate has been conducted in recent years, are anxious about the implications of the report. But I genuinely think it will lead to better, more inclusive and fair outcomes for everyone, including the trans community.
Wilkinson.
Thank you, Mr Speaker. I know the Honourable Member for Cheltenham is acutely aware of the impact cancer can have on families. We are committed to catching cancer earlier and treating it faster. We've achieved our manifesto pledge of 2 million extra appointments 7 months early, and we've invested in more surgical hubs, longer opening times benefiting 23 CDCs in the South West, and new radiotherapy machines. The National Cancer Plan will also seek to improve every aspect of cancer care, to improve patient outcomes and experiences across the country and including in the west of England.
Max Wilkinson.
Thank you, Mr Speaker. I thank the Minister for her answer. The Big Space Cancer Appeal being run by the Cheltenham and Gloucester Hospitals charity is something that's going on in my constituency. We're really proud of the work they're doing. They're having to raise £17.5 million for a new cancer centre at Cheltenham General Hospital, which is a regional cancer centre, because the previous government didn't fund it. Now, I'm very proud of the work that's being done by the hospital's charity and all the fundraisers, including my caseworker, Matthias, who's running 2 half marathons for the cause. But will the Minister meet with me and the 2 doctors, Sam Gugliani and Charles Candish, to discuss how the government might provide more support for this crucial piece of infrastructure?
Minister.
Thank you, Mr Speaker. I commend the Honourable Member's campaign activity for improved cancer facilities and commend Mattis's 2 half marathons, and I wonder when the Honourable Member will be doing his half marathon, and I can guarantee that I won't be joining him. We think it's absolutely fantastic that this is taking place. Local provision for healthcare is managed by the local health system, and I'd be delighted to meet with him and local representatives as soon as diaries allow.
Steve Young.
Thank you, Mr Speaker. Cancer care is important for people right across the UK, and in particular in respect of early diagnosis. How does the government plan to raise awareness amongst young people during Teenage and Young Adult Cancer Awareness Month to ensure that they're fully aware of the signs and symptoms of cancer?
Thank you, Mr Speaker. This is a really important issue, and we have reinstated the Children and Young People's Cancer Task Force, which I visited a couple of weeks ago, and tasked them to ensure that children and young people are a part of that. And the department will be marking the Teenage Cancer Month appropriately, and we encourage all children and young people to get the checks that they need and be aware of cancer symptoms.
Number 6, Mr Speaker.
Minister.
Thank you, Mr Speaker. I know this is a subject very close to his heart after many years of NHS service, and ensuring great careers for NHS staff, including nurses, has been a key theme of our engagement with staff to shape the 10-year plan. I will shortly be setting out further measures to improve progression for nurses and their colleagues in other key NHS professions.
I thank the Minister for her answer. Nurses across the profession are increasingly taking on complex roles and responsibilities, yet many do not have access to higher pay bands that reflect these changes, and there is too much variation around the country. As well as looking at this, will the Minister ask DHSC to implement a consistent model for supported structure progression from Band 5 to Band 6 for early career nurses based on the completion of key competencies and the acquisition of necessary experience?
Minister.
My honourable friend is right that NHS staff, including nurses, should be paid appropriately for the work that they are being asked to do, and we will ask them in the future to do. We're working with the NHS Staff Council to ensure that the National Job Evaluation Scheme is implemented fairly and consistently, as he says, across nursing and all professions.
Alison Bennett.
Thank you, Mr Speaker. A constituent of mine in Mid-Sussex, Ben, has spent 2 decades working as a nurse, and he tells me that his paramedic and midwife colleagues received automatic pay band increases post-qualification, while he and his nursing peers did not. Ben and his hard-working nursing colleagues have missed out on tens of thousands of pounds compared to colleagues in other disciplines. Does the Secretary of State agree with me that something must be done urgently to make up for this inequity?
I'm absolutely clear that we need to make sure, as I said, that the job evaluation schemes, that we look at staff across the piece and that people are rewarded absolutely appropriately for the work that they have been asked to do. We will do that as part of our discussions with NHS Staff Council, and obviously we will be looking, working consistently with staff as part of the 10-year plan to make sure that people are rewarded. We depend on them. We want to encourage them to be part of the NHS staff workforce, and that's the approach that we intend to take.
John Joseph.
Question number 7, please.
Secretary of State.
Thank you, Mr Speaker. The 18-week standard for elective care has not been met for almost a decade. That is the legacy of the Conservative Party. Our plan for change commits us to cutting waiting lists from 18 months to 18 weeks by the end of this Parliament through a combination of investment and reform. Since we took office, the waiting list has reduced by over 190,000. We achieved our manifesto pledge of 2 million extra appointments 7 months early, and waiting lists have fallen 5 months in a row. A lot done, a lot more to do. Change has begun, and the best is still to come.
Josie.
Thank you, Mr. Speaker. I welcome that NHS waiting lists for physical health have fallen for the last 5 months in a row, and the NHS waiting lists are down by almost 200,000 since Labour was elected. But with people who have mental health condition 8 times as likely to have to wait 18 months for treatment, what steps is the government taking to ensure that we see the same progress in waiting times for both mental and physical treatments, delivering parity of esteem the party opposite failed to achieve in their 14 years in power?
I'm grateful to my honourable friend for his question and his long-standing commitment to improving mental health services. Lord Darcy highlighted that those waiting over a year for mental health care outnumbered the entire population of Leicester, and we're committed to tackling this. We'll fix the broken system by recruiting an extra 8,500 mental health workers, introduce access to a specialist in every school, and roll out community Young Futures hubs in England. We'll shortly be publishing before Parliament our mental health investment standard report, which will show when it comes to mental health, this government is putting its money where its mouth is.
Christopher Cho.
Mr. Speaker, waiting times for patients living in the village of Burton outside Christchurch could be drastically cut if the local ICB was to approve the creation of a new branch surgery. That application has been outstanding for more than 4 months. Will the Secretary of State put a bomb under Dorset ICB and get them to approve this straight away?
Well, Mr. Speaker, that sounds like an invitation to commit a criminal offence, so I think I'll resist the temptation on that one. I'm sure they have heard his very forceful representations here in the House, and I'm sure we can make inquiries to get him an update.
Liberal Democrat spokesperson Helen Morgan.
Thank you very much, Mr. Speaker. Shrewsbury and Telford Hospital Trust has seen some of the longest waiting lists in the country for cancer and for A&E, among other areas. And they've been receiving national mandated support from NHS England's Recovery Support Programme. NHS England also provides improvement to support to hospital trusts struggling with excessive waiting lists through its Getting It Right First Time programme. Given the announcement to abolish NHS England, will the Secretary of State reassure my constituents that there will be continued support for hospital trusts, like Shrewsbury and Telford Hospital Trust, with unacceptable waiting times and a clear pathway to improvements for patients who deserve better?
Yes, Mr. Speaker, is the short answer to that question. Removing the duplication, the waste and efficiency that comes with having effectively 2 head offices for the NHS will lead to better, more effective and streamlined decision-making, but that won't in any way detract from the support that the honourable member describes. In fact, we should see more support and, crucially, more investment going to the front line as a result of the savings, the efficiencies and the improvements we're making.
Sir Hall.
Number 8, Mr. Speaker.
Minister.
Thank you. This government recognises the vital role that community pharmacies play as an integral part of our health system and local community. We're working with Community Pharmacy England on the pharmacy contract, which will start to stabilise the sector and make it fit for the future, and we will be announcing the outcome very shortly. On hub-and-spoke dispensing, we intend to lay draft secondary legislation in the coming weeks to come into force later this year.
Sir Hall.
Thank you, Mr. Speaker. Community pharmacy funding is at a critical juncture, with many pharmacies in my constituency facing financial challenges. With community pharmacy running costs increasing and uncertainty around the date of the upcoming settlement, they are concerned that there may be disruption to their businesses. What steps is the department taking to ensure that input from community pharmacies is considered and prior to any further legislative or regulatory changes relating to the hub-and-spoke model?
Minister.
I thank her for that question. She's absolutely right that we inherited a community pharmacy system that had been neglected for far too long, such that over the last 2 years, on average, 6 pharmacies have been closing every week. On the hub-and-spoke model, a wide range of community pharmacies and representative organisations fed into the public consultation on hub-and-spoke reform, and I'm pleased to confirm that their responses were overwhelmingly positive in support of Model 1 of hub-and-spoke, which is the model that we'll be going with.
Rishi Sunak.
Mr. Speaker, I recently visited Well Pharmacy in Northallerton, which, like so many others, plays an important role in providing community health services. Now, one valued service is the provision of free blood pressure checks to those over the age of 40. So can I ask the Minister join with me in urging anyone with health worries or indeed a family history of high blood pressure to take up advantage of this fantastic free pharmacy-led preventative community health service?
Well, I thank the right honourable gentleman for that question, and he's absolutely right that a big part of the government's shift from hospital to community is the pivotal role that community pharmacies will play in that process. We're committed to the pharmacy first model of enabling community pharmacies to do more clinical work, such as the type that he's just described, and we absolutely see that as being at the heart of our 10-year plan.
Dr. Luke Evans. Minister.
Now that he's abolishing NHS England, will he listen to the calls from the National Pharmacies Association and the Independent Pharmacies Association and publish the independent report commissioned by NHS England on pharmacies' finances immediately?
I thank the Shadow Minister for that question. We will be publishing the economic analysis imminently. He mentioned the National Pharmacy Association. That gives me the opportunity to say that I think the collective action that the NPA is taking is premature, unnecessary and detrimental to community pharmacy patients, and I would urge the NPA to reconsider its position and wait for the outcome of our negotiations coming very, very shortly with the CPE, and we'll be announcing that very soon.
Shadow Minister, look at
Thank you, Mr. Speaker. They've been waiting for months to get the answer on this, and they are indeed advising all of their 6,000 pharmacy members to reduce services and hours for the first time in 104 years. That's never happened under a Labour government, nor the Lib Dems or a Conservative government. It's this government. And the chair of the National Pharmacies Association said the sense of anger among pharmacy owners has been intensified exponentially by the budget, citing unfunded NICs and national living wage increases. So he acknowledges there's potential action. What contingency plans has he taken as the Minister and Department to make sure we keep patients safe if pharmacies close their doors in industrial action next week?
Well, on the point about the NPA, I mean, it's taken us a while to clean up the utter mess that we inherited in community pharmacy. That involved agreeing financial envelopes, getting into negotiations with the CPE. Those negotiations have been very constructive, and I am delighted to confirm again that we will be announcing very soon the outcome of those negotiations. I think what we see here is the Shadow Minister apparently taking the side of people taking collective action in a premature way that is detrimental to patients, and frankly, they would be better off waiting for the outcome, because we on this side are taking industrial relations into the 21st century as opposed to the performative nonsense that we saw for the last 14 years.
Question number 11, Mr. Speaker.
Straight to 11, sorry. Excuse me. Running through. I thank the Honourable lady for that question. When someone is detained, family involvement is extremely valuable, and families should be supported to maintain contact with their loved ones. Our mental health bill will strengthen requirements to involve families in people's care. We will require clinicians to involve patients and their families where possible when developing new statutory care and treatment plans.
Thank you, Mr. Speaker. I have two ongoing constituency issues with adult men who have serious and long-term mental health issues. One of my constituents believes her life is in danger because of her son's threatening behaviour towards her, and her own mental health has been seriously affected by the fear and stress. The other case involves a young man causing serious distress to his neighbours with his behaviour, which recently led to an incident where he reportedly threatened a police officer with a knife. Both men are living alone in unsupported accommodation. Both are at risk of coercion and abuse because of their own mental health problems, and both are causing serious distress to their families and neighbours. So could the Minister tell the House whether he is working with other departments to ensure there is more provision available to support people like my constituents to live safely in the community and not cause harm or distress to those around them?
Well, I thank her for that question. I know she has met with my right honourable friend, the Secretary of State, about at least one of those constituency cases. NHS England has asked mental health trusts to review the care of high-risk patients and has published national guidance on the standards of care that are expected. Ultimately, the Mental Health Act is there to protect people and provide the necessary powers to enable clinicians to manage and support such patients and, where possible, in the community.
Chris Spence.
Thank you, Mr. Speaker. Yesterday I met with Essex Partnership University NHS Foundation Trust and spoke about the need to support families of those suffering with mental health issues in Harlow, particularly those with caring responsibilities. Can I ask the Minister to consider how mental health services can better identify and support young carers?
Minister.
Well, I thank him for that question. He'll be aware that we are bringing forward legislation, the Mental Health Bill. A very important part of that legislation will enable family members, when they're chosen as a nominated person, to have powers to request assessment under the Act, challenge decisions and request considerations of discharge in line with the nearest relative powers.
Sir Smith.
Question 13, please, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. I commend my honourable friend for her dedication to improving support for children in her role as the Opportunity Mission Champion. Children with special education needs and disabilities may access a range of NHS services, including health assessments and specialised support. All integrated care boards must have an executive lead for SEND to ensure that this work receives the sufficient focus. And we're working closely with the Department for Education on reforms to the SEND system.
Sarah Smith.
Thank you, Mr. Speaker. As the Minister is aware, sadly last year we faced the devastating closure of the Vic Hospital after 14 years of mismanagement by the party opposite. I want to place on record my thanks to the frontline staff who've managed that transition and the operational challenges to relocate services. But sadly, a fully purpose building for children with SEND has had to be used to relocate these clinical services. So how does the Minister plan to ensure that those with SEND are at the heart of commissioning plans and service development?
Minister.
Thank you, Mr. Speaker. The system we inherited has been failing to meet the needs of children with SEND for far too long, and that's become clear with what's happened at Vic. But through the 10-year health plan, we will be considering all those policies, including those impacting children and young people. We're working closely with the Department of Education to support the delivery of the Opportunity Mission, but I also recently hosted a roundtable of children and young people, including those with SEND, so that they can feed directly into the 10-year plan and will be at the heart of our planning and our thinking on these issues.
Thank you, Mr. Speaker. Your heart would have been gladdened last week by seeing colleagues from across the House coming together to support my Down Syndrome Act debate, calling for that Act 3 years on to be implemented. The Minister for Bristol South responded for the government, said that Down syndrome specific guidance would be produced, which was really welcome. So could I ask the Minister to ensure that we now restrict the consultation group to those organisations which represent Down syndrome people only, and promise to the House that after 3 long years that we will finally see this statutory guidance issued before the end of this calendar year?
Minister.
Thank you, Mr. Speaker. I thank the honourable member for his question. Work to develop the Down Syndrome Act statutory guidance is being taken forward as a priority. We have a view to publishing it for consultation by the summer. It is involving people with Down syndrome as well as a wider group.
No come to topicals, Anneliese. Midgley.
Topical question number 1, please, Mr. Speaker.
So state.
Thank you, Mr. Speaker. Since I reported to the House on the government's plan to abolish NHS England, hammering the final nail into the coffin of the disastrous 2012 reorganisation of Lord Lansley, the reforms have been welcomed almost universally across Parliament, with the exception of Lord Lansley. I'm pleased to report the new Chief Executive of NHS England, Sir Jim Mackey, has appointed the transformation team that will deliver better care for patients and better value for taxpayers' money. We're working closely together as we finalise the 10-year plan for health, which will be published around the spending review in June.
Anneliese Midgley.
Thank you, Mr. Speaker. My constituent, June, is 74 years old and has stage 4 cancer. She had to queue, not phone, queue at 8 a.m. in the morning at her GP, only to not be given an appointment. Can the Minister tell me what he is doing to stop dreadful situations like this?
Mr. Speaker, I'm very sorry to hear of June's experience. And in fact, this illustrates why our determination to end the 8 a.m. scramble for appointments is so necessary, starting with a new requirement for practices to make online appointments requests available through core hours, as well as the big uplift we've invested into general practice. I hope that will start to see improvements that means people like June will not be left queuing outside in the cold.
So, Secretary of State, Ed Agar.
Thank you, Mr. Speaker. And may I just take this opportunity to thank the Secretary of State for his kindness following the death of my father early this month. It was very much appreciated. Mr. Speaker, I welcome moves to streamline decision-making and improve efficiency in the context of his NHS England announcement and if he genuinely drives decentralisation to ICBs. However, in a written answer on the 21st of this month, the Minister of State stated, and I quote, "We recognise there may be some short-term upfront costs as we undertake the integration of NHS England and the department." For clarity, can the Secretary of State confirm what he has assessed the quantum of those costs of the reorganisation to be and the date by which they'll have been recouped?
Secretary of State.
Mr. Speaker, I'm sure the whole House will want to send our condolences to the right honourable gentleman following the loss of his father, and it is good to see him back in action, if not always back in action. Look, Mr. Speaker, in answer to his question, there will obviously be, given the scale of the job reductions we're seeking to take and the savings we're seeking to make in the order of hundreds of millions of pounds, there will be some upfront costs. The total quantum will be determined once the final shape of the organisation is determined.
Thank you, Mr. Speaker. Can I also join with the Secretary of State in welcoming, as I did in January, his commitment to seek to work cross-party on the future of social care? He was right, and I welcomed that at the time. But like him and many others, we're all keen to see progress. Can he just update the House on when he anticipates the cross-party talks postponed in February will be rescheduled to take place?
Yes, I'm grateful to the right honourable gentleman's question. Baroness Casey will be making contact with all party groups in order to set dates with parties across this House very shortly, and of course she'll be kicking off her commission in April, which is now only days away.
Alan Strickland.
Thank you, Mr. Speaker. It's been brilliant to meet residents in recent weeks who've had their operation dates brought forward, thanks to the additional evening and weekend appointments the Labour government has funded. But we know too many people are still waiting too long. What more will ministers be doing to really drive down waiting lists in my community and across the country?
I'm grateful to my honourable friend for his question. As he says, we've brought NHS waiting lists down 5 months in a row, including during the peak winter pressures. We've delivered the 2 million more appointments we promised 7 months early, and we published our elective reform plan at the beginning of the new year with the Prime Minister, which sets out the combination of measures, the investment and reform that will make sure that we deliver the shorter waiting times and the faster access to treatment that his constituents and people right across the country deserve, and I look forward to keeping you updated.
People in unless we pick up the pace. Helen Morgan will be a good example, Liberal Democrat spokesperson.
Thank you very much, Mr. Speaker. In last night's Panorama programme, the Secretary of State was reported to have said that he doesn't need to wait for a review to put more money into social care, which we agree with. So if that's the case, will he explain why the Casey Commission will take 3 years and instead committing to getting it done this year to fix the social care crisis straight away?
Phase 1 of the Casey Commission reports next year. The final Casey report is due by 2028. But the Chancellor already announced an increase in funding for social care in the budget through means which her party seems to oppose, regrettably.
Mr. Speaker, it's impossible not to be inspired by my constituent Hayley and the bravery of her daughter Lily after she was diagnosed with an optic pathway glioma, aged just 1. Hayley stepped back from work not just to look after Lily, but to make sure she was able to campaign for change too. Now, the government's commitment to a national cancer plan is welcome, but with brain tumours not typically staged or screenable, how can we ensure they're not overlooked as part of the plan's development?
Thank you, Mr. Speaker, and I commend the honourable member's constituents' work with the brain tumour charity, and I wish Lily well in her treatment. The government has launched the Brain Tumour Research Consortium, which will support efforts to speed up the diagnosis of tumours and aid the recovery of patients, and the National Cancer Plan will ensure that we include brain tumour patients. We know everyone's cancer is as unique as they are, and this will be reflected in the plan.
In reviewing the NHS workforce plan, will ministers urgently review the pay and status of registered nurses, who are, after all, the backbone of the NHS? Many are now dependent on food banks. Thousands are saddled with student debt. And most NHS registered nurses will expect never to rise beyond Band 5, which is a maximum of £35,000 a year.
Secretary of State.
Mr. Speaker, the Chancellor took almost immediate action to deliver the uplift in pay for NHS staff that they deserve. We're working closely with the Royal College of Nursing, Unison and others to make sure we continue to tackle the challenges of low pay in the nursing profession, which the member describes.
Patricia Ferguson.
Thank you, Mr. Speaker. Since being elected, I've been contacted by a number of constituents registered with a GP in Scotland who find themselves unable to get medication for which they have a prescription while they're visiting in England. Will my right honourable friend take steps to encourage NHS England and NHS Scotland to work together to find a solution to the problem that works for patients?
Wow.
Well, I'm very sorry to hear about my honourable friend's constituents' experience. Accessing vital medicines while travelling between nations should be seamless, and I will ask NHS England to work with NHS Scotland to better understand what needs to change to make things easier for patients across the UK.
Solomon. Thank you, Mr. Speaker. In light of the recently announced 50% staffing reductions across integrated care boards, has the Secretary of State made any assessment of how these cuts to the Cambridgeshire and Peterborough ICB will delay the delivery of essential new primary care services for my rapidly growing constituency, particularly in North Stoke, Camborne and St Neots, where thousands of my constituents are already facing unacceptable difficulties in accessing care?
Mr. Speaker, despite the significant uplift announced by the Chancellor at the budget system, financial returns during the planning round suggested an overspend for the coming year of between £5 to £6 billion. When I said I wouldn't tolerate overspending in the NHS, I meant it. When I said I would go after unnecessary administration costs, duplication and bureaucracy, I meant it. That's what this government is doing to protect frontline services.
Jenny Riddle-Carper.
Thank you, Mr. Speaker. In Saxmundham, in my constituency, Dr Harvard has led a campaign for 20 years to transform the healthcare centre into a one-stop-shop community healthcare hub. His practice has already expanded services and in transforming health locally. Does the Minister agree with me that the Saxmundham Healthcare Hub is an excellent example and model for what this government is trying to do to transform community healthcare?
Minister.
Well, I thank her for that question. She's absolutely right that shifting from care from hospital to community is at the heart of our 10-year plan. I'd be happy to meet with the doctors leading this pilot to find out more about the excellent work that she describes.
In Jardine.
Thank you very much, Mr. Speaker. For 8 years, I've seen how a young constituent was able to completely control his previously life-threatening seizures with medicinal cannabis, but at huge cost to his family, cost which makes it prohibitive for other people. So will the Secretary of State meet me to discuss how we can make access to treatments like this more affordable, more accessible and safe to help more people?
I thank you for that question. We recently had a very helpful debate in Westminster Hall on this issue. We are doing more research into this issue to make sure that the evidence base is there. I'm happy to discuss that further with her.
Mohammed Jassim.
In the ongoing discussion on assisted dying, one point on which we all agree in this House is the urgent need to improve palliative care. I therefore welcome the government's recent commitment of £100 million to support hospices, which help my constituency as well. But what can the Minister confirm whether long-term funding for hospices will be a priority to upcoming 10 years health service plan?
Minister.
Well, I thank him, and he's right. The hospice sector has been provided with the largest capital spend in a generation, £100 million. We're also providing £26 million revenue funding to children and young people's hospices, and I can confirm that hospices will play a key role in our shift from hospital to community, as he set out in his question.
Victoria Collins.
Speaker, tragically, Ed was just 24 years old when he decided to take his own life, and that is why the family have joined us today in the gallery. What urgent action are the government taking to improve mental health care and suicide prevention for young people just like Ed?
Minister.
Well, I thank her for that question, and she raises a very important issue. We are investing in 8,500 more mental health specialists as well in every school, and Young Futures hubs across the country to ensure that we do whatever we can to prevent these tragedies happening.
Marcus Campbell-Savers.
Thank you, Mr. Speaker. An early day motion from 2007 noted that women were typically waiting 8 years to be diagnosed with endometriosis. Shockingly, nearly 20 years later, that wait has increased to 9 years. This government is right to tackle the appalling waiting list for surgery, but the 1 in 10 women who suffer with endometriosis often struggle with years of pain before surgery is even suggested. Would the Minister outline what plans the Department has to deal with these delays and how we can ensure that those working in primary care recognise this debilitating condition earlier?
It's a shocking, those statistics are shocking. I mean, campaigns led here and elsewhere have helped to raise the awareness. Nice guidelines updated will help. Our more appointments and our commitment to 18 weeks will also help. Training for GPs is now part of the core curriculum. We expect that to yield good results. There is look across NHS England with the ONS on the statistics with regards to diagnosis metric standard, and I'm happy to update him outside of this, and other members I know are very interested in how we make sure we deliver on these commitments.
Thank you, Mr. Speaker. My constituents in South West Hertfordshire remain concerned about the significant delay to Watford General redevelopment. With the Chancellor already bringing forward a second emergency budget for the House tomorrow, and with care homes, hospices and charities facing unsustainable pressure from this government's national insurance increases, what reassurances can the Minister give my constituents that the Labour Party truly cares about healthcare rather than scoring political points?
Secretary of State.
The irony, Mr. Speaker. Look, there's one big difference between what this government is doing and what the party opposite did for 14 years, which is that this government will actually deliver a new Watford General Hospital where the party opposite failed.
Chris Hinchcliffe.
Thank you, Mr. Speaker. Do ministers agree that it is a logical conclusion from the Darcy report that the National Care Service we committed to creating must be free at the point of use because, as Lord Darcy found, as long as the social care system remains means-tested and the NHS is universal, unmet care needs will continue to put unsustainable pressure on our health services?
Minister.
Well, I thank him for that question. Vitally important issue, and the Casey Commission will absolutely be looking about how best to create a fair and affordable adult social care system, including what structural reforms will be needed where health and social care meet, because reform must always be married with investment.
Cameron Thomas.
My general practitioners have consistently restructured over 10 years of constant systemic and economic pressures. How will the Minister convince the Treasury to exempt GPs from the increase to national insurance contributions and show my GPs that they have their back?
Yeah. Mr. Speaker, it was thanks to the decisions taken by the Chancellor in the budget that we were able to award £889 million for general practice, which is why my honourable friend, the Minister for Care, was able to agree a GP contract for the first time since the pandemic. The party opposite cannot continue to welcome the investment and oppose the means. They have to spell out where they would cut services or where they would raise taxes instead.
Yeah.
Stand back.
Thank you, Mr. Speaker. My constituent Danielle was diagnosed with POTS last year and found herself unable to get out of bed and unable to speak for long periods of time. She was unable to receive care in Scotland. Specialist treatment does not seem to exist for POTS. What more can we do for people like Danielle, and what conversations has the Minister had with counterparts about establishing specialist treatment in Scotland?
Thank you. In England, it is the responsibility of local integrated care boards to work with clinicians, service users and patient groups to develop services and care pathways that are convenient and meet the needs of patients with POTS. NICE has published a clinical knowledge summary on the clinical management of blackouts and syncope that provides advice for UK clinicians on best practice and the assessment and diagnosis of POTS.
Twice previously invited ministers to visit Bridlington District Hospital with me to see its much underutilised potential in light of the ongoing challenges facing coastal and rural health services and the newly announced changes to integrated care boards. Can I hope it's third time lucky and extend that invitation once again?
Yeah. Who's having it? Secretary of State.
Mr. Speaker, we're delighted to receive the honourable gentleman's representations. We'll look carefully at the case he makes and consider visits as diary allows.
Tulip Sadiq.
Mr. Speaker, much to my alarm, the North Central London ICB has recommended the closure of the maternity unit at the Royal Free Hospital in my constituency. The Secretary of State knows the Royal Free well. Will he meet with me to see how I can save my local maternity unit, which looked after me so well when I had gestational diabetes?
Minister.
Thank her for her question. These local services are so important, as she has experienced, for local women. It's really important that these reconfigurations are discussed with local members of Parliament and representing on behalf of their constituents. It's a matter, obviously, for the local ICB, but I'm very happy to discuss with her further.
Thank you, Mr. Speaker. Following my long-running campaign, I am grateful to the Government for finally updating the outdated Treasury rules that was preventing local health boards from spending more money on keeping city centre GP locations. Will the Government now issue guidance to local health boards and NHS trusts to accelerate the pooling of resources to get more services out of hospitals and onto our high streets, especially given that our high streets need extra footfall right now?
Secretary of State.
I'm grateful to the honourable member for all of the work she's been doing on this issue. She's absolutely right. We do need more integration of services, and we do need to look at where we can share facilities to achieve better care for patients and better value for taxpayers.
Shaw.
Thank you, Mr. Speaker. The former chair of my local trust in my constituency, Bradford Teaching Hospitals Trust, Dr Max McLean, has today secured a landmark victory in securing whistleblowing protection for him. Last week there was a non-exec director who marked a year since he was suspended. A third non-exec director has put in another further ET1. There appears to be a clear culture of targeting and witch hunting against the whistleblowers at Bradford Teaching Hospitals Trust. I appreciate the Secretary of State's team supporting me, but can he meet with me given these recent developments?
Secretary of State.
I'm grateful to the honourable member for raising these serious issues. I think there are issues of concern at play here, and she clearly describes a concerning situation for the local community. We do need to look carefully at what's happening here, and my honourable friend, the Minister of State for Health, would be delighted to meet her.
Richard Holden.
Thank you very much indeed, Mr. Speaker. Smile Dental Services serve one of the least affluent parts of my community in Basildon. They are actually looking to expand and provide more NHS dental services. We've come up against a few issues. Would the Minister either himself meet with me and them, or get some officials to come and meet with me and them to see what we can unblock to deliver more dental health services for local people?
Well, I thank him for that question. We're always looking for opportunities to unblock more capacity, and I'd be happy to meet with the honourable gentleman.
Lopez.
Thank you, Mr. Speaker. Coastal constituencies like mine in Bournemouth East suffer significant health inequalities. What is the Government doing to address these, and will the Minister meet me and Coastal Labour MPs so we can address this issue?
Minister.
Thank you. The honourable member for Bridlington and Wells is right. Coastal communities face unique challenges when it comes to health inequalities, and I will shortly be attending the APPG for coastal communities to meet with him and colleagues to discuss these issues.
Final question, Charlie Maynard.
Speaker, as the Secretary of State will know, in 2018, £40 million of funding was allocated by this House in memory of Dame Tessa Jowell, who was killed by a brain tumour. 7 years on, less than half this money has been spent. This money is doing no good sitting in a bank. Therefore, will the Secretary of State please commit to spending that money within a decade of Dame Tessa's death?
Secretary of State.
Mr. Speaker, I'm grateful to the honourable gentleman for his question. It gives me the chance to pay tribute to the late, great Dame Tessa Jowell, Baroness Jowell, and also the work that's now taking place in her name through the Tessa Jowell Brain Cancer Mission. There have been frustrating delays in getting funding out the door for the purposes for which it is intended. Ministers are looking very carefully at this issue, and we want to make more progress more quickly to make sure that families are not receiving the same death sentence that our late friend did.
Point of order, Dr. Luke Hatton.
I'm grateful, Mr. Speaker, for the point of order. Since the 14th of January, I've tabled 15 name-day written parliamentary questions to the department. Of these, 14 have received a holding response, meaning just one was answered on time. A very simple example, Mr. Speaker, was I asked how many times the Minister had met with Community Pharmacy England. I received a standard holding answer 4 days later saying it will not be possible to answer this question within the usual time period. It then took 5 days for an answer to come, which said ministers meet regularly with external stakeholders in a variety of topics, including but not limited to pharmacy. So could I ask the Speaker his advice on what mechanisms are in place to ensure name day questions are answered in time? And if they continue to be not answered in time, how can I elevate that further?
Well, first of all, I am disappointed they've not been answered, but I am not responsible for ministerial answers. What I would say, I hope the Treasury bench, and obviously the Secretary of State as well, has taken on board the importance of replying name day questions are called that because they're meant to be answered by that day. So I would say I'm very disappointed that departments may be overworked. If that's the case, maybe we ought to bring staff in from other departments to ensure that questions are answered on time. But I am sure, I know the Secretary of State will have made a note immediately to ensure that they will be answered. Right, let us complete and move on.
See you later.